Good morning, everyone. I'm presenting my seminar on classifications of malocclusion. The content of my seminar includes introduction, definition, needs of classification, interarch and interarch malocclusions, angles classifications, modifications, and various types of malocclusion, conclusions and references. Introduction. The earliest scientific description of malocclusion was given by Samuel S. Fitch in his book, A Systems of Dental Surgery. He was the first to classify malocclusion into four states of irregularities. Friedrich Christopher described malpositions of all the teeth as a general obliqueness and a partial obliqueness. It is a way of him defining malocclusion. Nicholas Majorin differentiated obliqueness of teeth and anomalies in dental arches. George Carabli described abnormal relationship of the upper and lower dental arches in coined the term edge-to-edge bite and overbite. Definition of malocclusion includes malocclusion may be defined as a condition where there is departure from the normal relation of the teeth to other teeth in the same dental arch or to the teeth in opposing arches. So, what is need for classification? Classification can help us to identify grouping of orthodontic problems, location of problems to be treated, diagnosis and treatment planning, comparison of different types of malocclusion for communications, documentation of problem used for epidemiological study. It can be used and help us in visualizing and understanding the problems associated with that of malocclusion and comparison of various malocclusion, which is made easy by classifying them. So what are the types of malocclusion? It can be either intra-arch malocclusion, it can be either inter-arch or skeletal malocclusion, or it can be either dental malocclusion. In intra-arch malocclusion includes variation in individual tooth position or a group of teeth within an arch. Here we can see it is a group of teeth within an arch. Okay? Inter-arch malocclusion involves it comprises of mal relationship between teeth or group of teeth of one arch and to another arch, such as this. Here there is malalignment of teeth in one arch which leads to malocclusion in the other arch as well. And skeletal malocclusion, which can be involves apical basis, upper and lower relationship to the position of teeth of maxilla and mandible. So what is intra-arch malocclusion? It can be either, it can be differentiated as mesial inclination in which the teeth is inclined mesially. It can be the distal inclination in which the teeth is inclined distally. Lingual inclination, or also known as retroclination, it is an abnormal position or lingual or palatal tilting of the tooth. It's as we can see over here. Buccal inclination or proclination, as we can see over here, is labial tilting of the tooth. Mesial displacement, it refers to as a teeth or a tooth that is bodily moved in mesial direction towards the midline. Here the tooth is moved in mesial direction towards midline. Distal displacement is an example in which the tooth that is bodily moved in the distal direction away from the midline. Lingual displacement involves a condition where the entire tooth is displayed in lingual direction. Here, the entire tooth is displayed in lingual direction. Buccal displacement is the condition wherein the tooth is displayed bodily in labial or buccal direction. So, what is extrusion, or which is also known as supra-eruption of a tooth? It is a condition in which teeth has over erupted or as compared to that of the other tooth in the same arch. Intrusion is same opposite to that is extrusion. It is also known as infraversion of teeth, which refers to as tooth that has not erupted enough as compared to that of the other teeth in the same arch. Distolingual or mesiobuccal rotation is known as something in which the tooth that has rotated around its long axis as so that the distal aspect is more lingually placed. In mesiolingual or distobuccal rotation, it is a condition in which the tooth is mesial to the aspect of lingually placed teeth. Transposition is something in which there is a condition in which two teeth have changed their position. Inter-arch malocclusion involves, it can be either in vertical plane or it can be either in horizontal planes. The deep bite or increased overbite and open bite is considered to be malocclusion in vertical plane. This refers to as a condition wherein there is an excessive vertical overlap between upper and lower anterior teeth. Open bite, it is a condition in which there is no overlap between the upper and lower teeth. Angle classification, it is the most commonly and most widely used classification. Angles, Edward H. Angle in 1899 introduced angles classification based on the mesiodistal relationship of the teeth, dental arches and the jaws. According to him, the maxillary first permanent molar is the key to occlusion, and he considered this as a fixed point or fixed anatomical point within the jaw. He has classified malocclusion into four types. Those are class 1 malocclusion, class 2, class 3 and class 4 malocclusion with various subdivisions also. We'll look upon it accordingly. According to Angles, in class 1 malocclusion, he stated it represented by relative position of jaw and dental arches mesiodistally normally with first molar usually in normal occlusion, although one or more may be in lingual or buccal occlusion, ranging from the simple overlapping of single incisors to the most complex dearrangement involving the position of all the teeth in both the arches. Class 2 involves relative mesiodistal relationship of jaws and dental arches abnormal to the lower teeth occluding distally or normal such that class 2 and has more than half cusp premolar width in distal occlusion. Class 3 is something in which the lower molars is forwardly placed as compared to that of the upper incisor. He defined it as it is a relationship of jaw and dental arches is abnormal, the lower being more or less mesial to the upper such that it is half cusp premolar width mesio-occlusion. This half cusp premolar width mesio-occlusion is important as he has defined it according to the width of the cusp. In class 4, it is the relationship of the jaw in which there is mesio-occlusion on one side and the distal occlusion on another side. In angle 1, malocclusion, the various types of various types seen as angles. Class 1 characterized by presence of normal inter-arch molar relation. Angles define class 1 malocclusions as a relative position of dental arches mesiodistally, a normal with mesio-occlusion, usually confined and anterior teeth. Mesiobuccal cusp of maxillary first molar occlude in the buccal groove of mandibular first molar. Occlusion could be crowd. Malocclusion could be crowding, spacing, rotation, missing tooth, anything it can be there. The other point is it may also include a displaced or impacted tooth anomalies. Variations can be seen. Biomax protrusion is a type in which patient exhibits a class 1 normal relationship, but the dentition of both the upper and lower arches are forwardly placed in relationship of that of the facial profile. Angus class 2 malocclusion is a malocclusion as retrusion of lower jaws with distal occlusion of lower teeth. The distobuccal cusp of maxillary permanent first molar lies within the buccal groove of lower first permanent mandibular molar. It is divided into two subdivisions, that is division 1 and division 2. In division 1, there is proclination of the upper incisor with increased overjet. Deep overbite is seen. Then a presence of abnormal muscle activity is present. Lip seal is short, or there is an upper lip which is hypotonic. It is also seen. Lip trap is very evident in class 1. In class 2 division 1 malocclusion, and the muscle imbalance is produced by hyperactive buccinator and mentalis, and altered tongue position may also be present. Plus a V-shaped arch may also be present in class 2 division 1 malocclusion. In class 2 division 2 malocclusion, there is retroclination of the upper incisors Patient exhibits a deep anterior overbite. Lingually inclined upper central incisors gives an arch a squarish appearance. Abnormal backward path of closure may be present. Then, von der Linden's classification is a modification which is seen in class 2 division 2, in which there are three types. Type 1 involves the upper central and the lateral incisors are retrocline. It is less severe in nature. Type B is the central incisors may be retrocline or overlap by two lateral incisors. And type 3 involves central incisors and lateral incisors are retrocline and overlapped by the canines, as we can see each of the examples in the picture. Then class 2 subdivision is something in which class 2 molar relationship exhibits on one side and class 1 relationship exhibits on the another side. It is referred as class 2 subdivision. It can be either class 2 division 1 with class 2 division 1 subdivision or class 2 division 2 subdivision. Then angles class 3 malocclusion. It is defined as protrusion of lower jaw with mesial occlusion of the lower teeth. Lower incisors and cuspid inclined lingually. In this, the mesiobuccal cusp of maxillary first molar occlude interdental spaces between the mandibular first and second molars. It can be classified either in true class 3 or pseudo class 3. What comes under true class 3? It is seen if it is of a genetic origin or due to excessively large mandible, forwardly placed mandible, smaller than normal, which is smaller than the normal maxilla, retruded retroposition of maxilla, then the lower incisors tend to lingually incline in case of true class 3. But on the other hand, in case of pseudo class 3, it may be a case in which the patient produce a forward movement of mandible during closure. It can be either due to presence of prematurities but may deflect in the mandibular forwardness, or in case of premature loss of deciduous posterior teeth, a child with enlarged adenoids tend to move mandible forward to prevent tongue from contacting adenoids. Then, while we compare class 3 pseudo or true malocclusion, what are the factors which can be seen? Class 3 molar relationship is seen in true class 3, while class 1 molar relation is usually seen, and functional interference may be seen in case of pseudo class 3. Then skeletally it is class 3 in true class 3, and in pseudo class 3 it is not the case. Then patient cannot move the mandible forwards to edge relationship in case of true class 3, but patient can easily move the mandible forward in edge-to-edge bite if the case is pseudo class 3. Then the maxilla is well developed in case of true class 3, whereas the maxillary arch may be constricted in pseudo class 3. There is no change in profile as mandible moves to centric relation to rest in case of class 3, while in pseudo, profile improves as the mandible moves in centric to rest. Class 3 subdivision involves as a condition. It is a condition which is characterized by class 3 molar relation on one side and class 1 molar relation on the other side. Backward drawbacks of the angles classifications are: angles consider the malocclusion only in anterior posterior plane and not in transverse or vertical plane. Second disadvantages, he considered the first permanent molar as a fixed point, which is not true in all the cases. The third disadvantage is the classification cannot be applied if first molar is missing or extracted. Fourth involves the classification cannot be applied in decidustant tissue. The another disadvantage is classification does not differentiate between skeletal and dental malocclusion. Then the classification is not highlighted the etiology of malocclusion, and individual tooth position not have been considered by angles. What is Dewey's modifications of angles classification? There are 5 subtypes in case of class 3 and class 1. There are five subtypes in case of class 1 and 3 in case of class 2. First, class 1 modifications are: type 1, class 1 malocclusion with bunched or crowded anterior teeth. Second is Class 1 with protrusive maxilla. Class type 3 is malocclusion with anterior crossbite. Type 4 is molar relation, class 1 molar with posterior crossbite, and type 5 is permanent molar has drifted mesially due to early extraction of second deciduous molar or second premolar. Device modifications in angles class 3 are of three types. In type 1, the upper and lower dental arches, when viewed separately, are normal alignment, but when the arches are made to occlude the patient, shows an edge-to-edge incisor alignment. Type 2 involves the mandibular incisors are crowded and are in lingual relation to that of the maxillary incisors. Type 3 is the maxillary incisors are crowded and are in crossbite in relationship to mandibular incisors. Lister's modification is same as that we have discussed earlier. That is, it can be either neutro-occlusion, which is seen in case of class 1 malocclusion. It can be either distal occlusion, in which we can see in class 2 angles malocclusion. In mesio-occlusion is angles class 3 malocclusion. Bucco-occlusion is buccal displacement of the tooth. Linguo-occlusion is lingual placement of the tooth, as we know. And supra and infra-occlusion are something in which there is supra-eruption of teeth and infra-eruption of the teeth. Then mesio-occlusion is something in which the occlusion is more mesial as compared to that of normal. Then distoversion is distal to the normal position. Transversion is transposition of tooth. Axoversion is abnormal axial inclination of the teeth. And torsioversion is rotation of the tooth. Then Bennett's classification. It is based on the etiology. In class 1, abnormal position of one or more teeth due to local causes. Type 2 involves either abnormal formation of part 1 or the whole arch may be abnormally developed. Class 3 involves abnormal relationship between the upper and lower arches, between either the arch or facial contour, correlated abnormal and formation of entire arch. Then what is Simon's classification? It is a craniometry classification which is based on anthropometry planes, that is Frankfurt horizontal plane, then the orbital plane and mid-sagittal plane. These three planes are used as a reference in case of Simon's classification. Classification was based on abnormal deviations of the dental arches from their normal position in relationship to the three planes. Frankfurt horizontal plane, it connects the margin of external auditory meatus to the infraorbital margin. This plane is used to classify malocclusion in vertical plane. When the dental arches or the part of it is closer to that of the normal Frankfurt plane, it is called as attraction, and if it is farther away, it is known as abstraction. Then in case of orbital plane, it is perpendicular to that of Frankfurt plane. Drop down from the orbital margin directly under the pupil of eye. According to Simon's, this plane should pass through the distal third of the upper canine, called Simon's law of canine. This plane is used to describe malocclusion in sagittal or anterior-posterior direction. When the dental arches or the part of it is away from the orbital plane, it is known as protraction, and when the dental arch is closer or placed more posteriorly, it is known as retraction. Mid-sagittal plane is something which describes malocclusion in transverse direction. When the part or whole of arch is away from this plane, it is known as distraction, while the dental arch is near to this plane, it is known as contraction. Ackermann and Profit classification is something in which Ackermann and Profit described it in 1960. Here, there are 5 characteristics, that is alignment, profile, transverse relationship, class, and deep bite depth. In step 1, alignment, the first step involves assessment of alignment and symmetry of dental arches. It is classified as ideal, crowded, or spaced. Second is profile, which involves either convex, straight, or concave profile. Then it can be either type, in which the transverse skeletal and dental relationship is evaluated. In step 4, it involves assessment of sagittal relationship in angles class 1, class 2, or class 3 malocclusion. And fifth is bite depth in vertical plane are noted. Then, what are the advantages and disadvantages of this malocclusion classification? Only cases it can advantages is only cases with arch length problems are used to recognized. The influence of the dentition on the profile is considered. Malocclusion can be recorded in all the three planes. Skeletal and dental problems are to be segregated appropriate levels. Diagnosis is inherent in this methodology. Quantification and assessment of severity of malocclusion can be done. Then the disadvantages involves very delicate, very detailed and therefore time consuming. Do not include etiology. Only the static view of occlusion is considered. Fourth is communication is not easy without a thorough knowledge of the system. The last is British Standard Classification of Incisors, in which the class 1 malocclusion involves the lower incisor edge occludes with or lie immediately below the cingulum plateau of the upper central incisors. Class 2 is lower incisor edge lie posteriorly to the cingulum plateau of upper incisors. Subdivision sub 2, there's two subdivision, class 2 division 1 and division 2. The upper central incisors are proclined or average inclination and there is an increase in overjet. And the second is the upper central incisors are retroclined and the overjet is usually minimal or maybe increased. The third is the lower incisor edges lies anteriorly to the cingulum plateau of the upper incisors. The overjet is reduced or reversed. The incisor classification is same, so I'll skip it. The classification in primary dentition is instituted by Brumin in 1959. States three classification, that is flush terminal planes. As the first permanent molars erupt, they will be in end-on molar relation with that of presence of complete deciduous dentition having a flush terminal planes. This relation develops into class 1 molar relationship following exfoliation of the lower deciduous second molar as a result of mesial migration of the lower permanent first molar. In distal step, in case where the upper deciduous second molar is ahead of that of the lower deciduous second molar, it gives rise to a distal step. It is the case in which can lead to class 2 molar relationship in permanent dentition. And in mesial step, the case where the lower deciduous second molar is ahead of the upper deciduous second molar, it gives rise to a mesial step. This can either lead to class 1 molar relationship or a class 3 molar relationship in permanent dentition. I would like to conclude by saying a comprehensive classification of malocclusion is beneficial in orthodontics and it aids in treatment planning, communication, interdisciplinary collaboration, research and education. In conclusion, the classification in orthodontics serves as a crucial roadmap for orthodontic professionals, guiding them through the complexities of diagnosis and treatment planning. This systematic approach enhances patient care, ensuring tailored interventions that address specific malocclusion types. These were my references. Thank you.